Hi, this is Sue for Parkies and Me, My Journey with Parkinson's. Today I'm joined by Kirstie Collar, who is a speech-language therapist. Is that right, Kirstie?
That's correct.
So I've heard people call themselves speech pathologists. Is that different?
So speech pathologist is a term that's used primarily in America and Australia. So that's their term, which is the equivalent to speech language therapist. They'll call themselves a speech language pathologist. So it's just a different title meaning the same thing. If you're going to get technical about it, a pathologist diagnoses a problem and a therapist both diagnoses and treats.
Okay.
So that's why in New Zealand we like the term speech language therapist, because we'll diagnose the problem and then provide therapy for that. But it's really just a difference. In fact, the degree that New Zealand speech language therapists get is a degree in speech and language pathology, meaning specialists in diagnosing various communication and swallowing difficulties. But either of those two titles would be a very good person for someone with Parkinson's disease.
Thank you. And the reason I asked that question is because I have people listening from other countries, Australia for one, but I know that it reaches people all around the world and they would call themselves something different. So it's good to establish that it's basically the same kind of role.
Yeah, absolutely. And in fact, there's a memorandum of understanding between Australia, New Zealand, the USA, Canada, and the UK, which means that all of the speech language therapists and speech language pathologists in those countries all have equivalent qualifications.
That's excellent. That's good to know. Tell me, this is a very broad question. What does a speech language therapist do?
Wow, that's really broad. So a speech language therapist does a myriad of different things. In a nutshell, a speech language therapist works to help anyone that has any sort of communication or swallowing difficulty or challenge, and that can be across the lifespan. So it can be anything from neonatal intensive care with tiny wee babes that are having initial establishing and swallowing, right through to end of life with any sort of problem with speech or language or communication and thinking, fluency, voice, and swallowing. So a really broad range of things. Did you want to know specifically in regards to Parkinson's?
Yeah, that would be good if you could. Shall we break it down? So let's see if we can do it by topic. What might be the first thing that you would want to test on a person with Parkinson's?
So the first thing that we do whenever we meet with and talk with someone with Parkinson's is actually get a really good handle on what is their most significant concern and be very much patient-led or person-centred and person-led. So what for them and their whānau or their wide support network is the biggest problem. And for some people that will be communication, and often one of the first signs or symptoms someone with Parkinson's might notice, or even more so their significant others might notice, is a drop-off in the volume of their speech. Sometimes people might hear that called something technical like hypophonia. It really just means quieter voice, and that's often one of the very first things. So often that'll present itself, and it might even be things like we're out in a group now and it's really hard for me to be heard over background noise, or people are always asking me to repeat, or another really typical one is, oh, of course my partner's hearing's no good anymore.
Oh, I've been guilty of that.
And if I had $1 for every person with Parkinson's that told me that their partner's hearing was off, I'd be a wealthy woman. Having said that, it takes two to tango, and communication's very much a partnership. So there can be problems from the receiver or the listener as well. But often voice. The other thing that people with Parkinson's often notice is that their voice quality can change. So as well as being quiet, they sometimes can find various different ways that people might describe it: hoarse, croaky, scratchy. And the other thing is that people with Parkinson's can sometimes lose the naturalness in their voice or the expressiveness. And so people often say, oh, everyone thinks I seem down or flat or like I've got a cold or off. and often that's just an impact of the Parkinson's on the voice. So often we'll look at all of those factors around voice, then also look at other communication factors. One of the other things that probably people might ring a bell for them, for listeners, is a sort of flatter facial tone as well as voice tone. So that not expressing your emotions through your face as well. Sometimes people talk about the mask of Parkinson's disease. And often listeners might think of high-profile people with Parkinson's, like, for example, Michael J. Fox, and think, oh, yes, he looks a bit more flat and not as expressive as an actor used to be. And that sort of that amplitude or strength of movement, just as that affects the strength of voice, it can be their strength and the ability of the muscles to naturally convey what you're thinking or feeling. So often we'll look at those non-verbal communication aspects as well. Something else is use of gesture and whether that's changed with the movement changes. And then some of the other things can be the clarity of speech, so how clear speech sounds are and words are, how much puff you've got to power your voice, that can change a little bit as well. Very practical things like eye contact, if someone's in a stooped position, that can be really hard. So looking at all those non-verbal aspects, speech clarity aspects, and then often just checking in with someone about some of the ways that we use our thinking skills in communication. That can be things like being able to find the words, that tip of the tongue phenomenon. When you really know what you need to say, and we know that the person with Parkinson's has got all that lifetime of wisdom and knowledge in there, but just that tip of the tongue, the words there, but it just won't come out. Or being able to sustain focus and screen out distractions, being able to formulate thoughts as quickly into sentences as previously, or to interject in a conversation, or being, I guess, as active or initiating conversations as much. Many people say that they feel a little bit more passive.
Can I interject?
Absolutely.
Oh dear.
And so you did a brilliant thing there, which is put your hand up, because actually using that non-verbal communication is really important.
Yeah, it is. And I can identify with a number of those things that you were talking about. I know that when I'm talking to my husband and I start saying a sentence, if it's a reasonably long sentence like this one, I have to stop and take a breath, and it gets quite breathless at the end of that long sentence. So I'm very aware of that. Yes, I go to a social sort of group of ladies who bowl, but a lot of it's having a cup of tea and then playing a bit and have another cup of tea. And sitting around with 6 people, and they're all talking, you think, oh, I want to interject with a comment there, and you can't get people's attention the same. So I'm going, yeah, it can be quite frustrating, especially for somebody who has always been a talker.
Absolutely, and that can be a massive change in your sense of identity of how you are in a group and your communication style. And I think for us, it's about empowering people to find other ways to get that voice back and that sense of who I am as a communicator. And that might be doing something as simple as what you just did then, which is just hold your hand up and go,
Hey!
Just, something to hold the space, because by and large, people we communicate with, or communication partners, want the communication to be successful and they don't want it to break down. So just some simple strategies can really get those people on board.
Until I get a really dry mouth. In fact, if it gets too dry, I start to gag, and I have to really quick get a sip of something there. I try and sip on a water bottle when I'm doing something like this. And the other thing is, where is it? I have got some stuff that I think you gave me.
Ah, perfect.
The one we prepared earlier.
Oh, oral gel. About over 70% recent research says of people with Parkinson's have some sort of changes with mouth dryness or increased secretions. So that's not that someone's producing more saliva, but they're just not swallowing automatically as frequently. So definitely that's another area that speech language therapists, speech language pathologists can help with, is actually looking at how is that for that person. Usually it's a result of both the Parkinson's itself, but often also medication side effects, and actually coming up with some tailored solution, something really simple people can try if they want a take-home tip at home, is just if they're finding dry mouth as an issue before extended conversation, or for example on the telephone, or what we're doing on a video call or a online call, is actually just running our face cloth under some hot steamy water, getting it nice and warm, and then popping that over their mouth and breathing through that, and that just gives a bit of extra moisture and lubrication that will last a short period of time. But something like an artificial saliva also works, and absolutely sips of regular water.
Cool. Speaking of water, I think I need to go and fill that water bottle up. So while I pop out for a minute, can you just talk about why people might experience drooling? I experienced a bit of drooling. So if you could just talk about that, and I'll bob out and I'll be back in a tick.
Absolutely. So drooling is something that happens, it can happen either as a result of medications, side effects that people may find, either it produces dry mouth or increases sometimes saliva, but more likely than that is that the Parkinson's is affecting swallowing, and so that means that people aren't swallowing as frequently as they would have prior to Parkinson's to clear their own saliva. I once heard a fun fact that we swallow approximately a Olympic-sized swimming pool of our own saliva over a lifetime. I can't vouch for the accuracy of that, but it gives you some idea of we're swallowing sort of 5 to 10 times every 5 minutes, every 5 to 10 minutes, just to clear our saliva. And so if that drops off, the saliva will build up, and that coupled with reduced strength in the lips can mean that you can get a little bit of drooling. The other thing that happens is that saliva can become thicker or tackier, either with medications or with a tendency for people with Parkinson's symptoms to breathe through their mouth a little bit more, and that can then through their nose. So when you breathe through your nose, is like a big dehumidifier on the front of your face, and that makes sure that the air going in is moistened, and then that keeps the saliva in your mouth and throat nice and moist. But if you are breathing through your mouth more, then the saliva gets dried out, it gets thicker and tackier, and it doesn't automatically swallow down your throat as easily, and that can contribute as well. So the key things, I guess, that are first place to start, just for anyone with Parkinson's, is to keep your hydration up. So just as you've just done, try and reduce things that are drying, like too much caffeine or alcohol. Obviously, if you're a smoker, give that up. That will make life worse. And then keeping your hydration up, try regular steam through the face cloth. That can be a really helpful thing. And just consciously thinking of suck back and swallow, because it won't be happening as automatically anymore. If it's a matter of lip weakness, or if you find that it's happening more often with meals, things coming out, a really good thing you can just try is try running an ice cube around your lips just before a meal. That'll just heighten a sense of awareness of your lips feeling, and that might mean that you get a bit of increased tone and they hold together a bit stronger during the meal.
Yeah, but for me, it doesn't seem to be that I'm drooling during meals. It seems to be when I'm actually talking to people, and it's just on this one side, and it's wearing a groove in my face. A few more wrinkles.
And that is, I'm imagining that is very much just that reduced number of automatic swallows during speaking compared to what you used to do. So again, even if it's something simple, I've got a video call coming up or I've got a phone call coming up, maybe even just wiping that ice cube around your lips and just see if that gives a bit of a heightened awareness there, so that when saliva hits them, you're more likely to automatic swallow. And keeping your, even though people tend to think, oh, it's counterintuitive to drink more because then I'll be producing more liquid, it actually keeps the saliva nice and thin so that it's more likely to track over the back of your tongue and be swallowed rather than get thicker and build up in your mouth and be drooled out the front.
So this whole swallowing thing, there's so many aspects to it. The other thing that I've found, and I think it was you that gave me a piece of advice, was that sometimes in the morning I would describe my secretions as like having a gummy throat, that feels really thickened, and I have to keep clearing my throat, and it gets really uncomfortable and irritating, not just for me but for other people. I think it was you that said to get some Coke and just have sips of Coke to thin things down a bit?
Yep, that's certainly, you don't get many health professionals recommending Coca-Cola. No, certainly don't recommend it as a drink of first choice, but certainly for thickened secretions, and I was just talking about this a little bit when you're out of the rooms, but sometimes we can find that people with Parkinson's can tend to breathe through their mouth a bit more at night than they used to, and that means that everything gets dried out and then the saliva thickens up and gets quite thick and tacky. And when that happens, steam will break it down, so steam inhalation. As a first aid measure, Coca-Cola will just break down that thickened tackiness and might help clear it. The other thing to be aware with that feeling that you need to clear your throat is that sometimes then people can get into doing a throat clear, like a
Been there.
to try and clear it. Yep. And when you do that, you're actually scraping your vocal cords together, and that causes them to swell and produce more mucus. So then you want to clear your throat again, and so you get into a nasty cycle. The better thing to do is to try and have a sip of water, because that will clear that feeling without causing more mucus. And if you can't do that, is to at least, at a minimum, to cough instead of throat clear. So a cough slaps the vocal cords together and is a little bit less traumatic. It's better than it.
Okay. That's good to know. I might need to throat clear if I don't drink some water.
Yeah, absolutely.
So we've talked a lot about swallowing and that sort of thing. What I'm wondering is about swallowing things like bread. I know for myself, if we have hamburgers or anything that goes in a bun, I go for things like the brioche buns because they're softer and easier to swallow.
Softer.
But I always have a water bottle with me because just sometimes out of the blue you think, gosh, that's just not going to go down. And you have to get some water to help it on its way.
Yeah, absolutely. We've talked about swallowing with secretions and saliva, but also very high percentage of people with Parkinson's, and by that I'm talking around the 80% plus mark, have problems with, at some stage, with eating and drinking food and fluids of some sort. So just as the Parkinson's affects movement of limbs, it also affects the movement of the muscles of the lips, tongue, jaw, soft palate, and the contraction of the throat and closing off of the airway. So what that can mean is that different sorts of food and fluids can become difficult for different sorts of people with different sorts of symptoms. But certainly chewing and breaking down bread and glutinous foods can be a really common one, and that's because saliva changes, first of all. So we need saliva to break that stuff down, and if that's changed, that can impact. Then the strength needed by your tongue to move the food between your teeth and your jaw to then chew it up. And then for the muscles of your throat and tongue to push together to squash that through, down past the closed off airway into your esophagus and then down into your tongue. So that can definitely be an issue. Sometimes some things as simple as you've said, so just changing the type of bread. Soft brown bread's often easier than white bread. Seems to be a little bit less glutinous. Adding extra toppings that are moist will keep things moist, but certainly anyone that's experiencing swallowing problems, and particularly if they're finding that they're getting coughing or choking or that sense of things going the wrong way, keep an eye out for something that can happen. If that happens frequently, as things can go down the wrong way, enter the lungs and cause chest infections. So if you've found that you've had unexplained chest infections, you don't know why, that's a really big red flag. The other one is losing weight, because if it becomes hard to eat and drink, I know, hard to eat and drink, sometimes that people will find that their appetite drops off and then they lose weight. So there are some good times to really ask to see your GP in the first instance and ask for referral to a speech and language therapist or speech language pathologist, and then they'll assess those problems, usually just by doing a good case history, talking to you, doing a clinical exam, and then doing some sort of instrumental assessment, which sounds very full on, but really just means, and you'll remember this, so having some things to eat and drink under x-ray, that's called a video fluoroscopic swallowing study, or overseas sometimes called a modified barium swallow. Or another type of assessment the therapist might do is putting a little endoscope up the nose and going down, looking down the throat with a tiny wee camera, and then finding some individual strategies that help.
So I'm really glad that you talked about video fluoroscopy. I know when I was working on the ward, we used to send people over for the shortened form of that is obviously VFS, and hear that and think that sounds a bit scary. But yeah, I've had it done. You've been there. And I've had that done 2 or 3 times now, and it's not great tasting, but it's not anything to be feared. It's quite gentle and well supported, and it's a good thing to do to get a baseline of where you're at and if there are any changes down the line.
Absolutely, and I think too that the therapists there have an obligation to let you know exactly what to expect and then to be guided by you. But I think given all the different tests we do in hospital, it's not a bad one. I think the worst thing about it, as you said, Sue, is that we add a little bit of barium powder to the food and drink that we get you to swallow, and that can make it taste a bit chalky, but that would be the worst side of it.
Yeah, it's not that bad at all. So I'm just I've written a few little notes for myself just trying to make sure that we don't miss out on anything. When a person is diagnosed with Parkinson's, how soon do you think that they should see a speech-language therapist? Or another thought, do they need to see a speech-language therapist? There doesn't seem to be anything immediate for a speech.
That's a bit of a hard one. I always think I'd rather see people earlier and give them some maintenance strategies so that where the ambulance not the ambulance at the bottom, but the fence at the top. Having said that, that was why I really liked a few years ago the Parkinson Society used to run a program called Living, and that was seeing people when they were first diagnosed and just giving some basic information. Hey guys, these are the things you can look out for in the future, and these are things that'll keep you communicating and swallowing as best you possibly can. What we tend to say is that when people are first noticing that maybe their voice is a little bit quiet or they're needing to repeat themselves or just there is minor saliva changes, get in early, and then we can come up with some maintenance strategies and keep people functioning as well as possible for as long as possible. And a lot of our speech language therapy interventions, and I'm thinking of things for both communication and swallowing, aimed at maximising function and maintaining your ability to communicate in all the situations you need. So if someone's working, get in fast, and we'll try and give you some strategies that'll help communication in the workplace so that you don't need to change whether you work or not. Or if you're actively grandparenting or parenting and you're needing to read stories to a child or just whatever your important stuff is, sooner rather than later. There are many group programs for people with Parkinson's.
Sorry, you've just read my mind.
Things. Oh. Shall I let you ask the question?
So about the importance of speech and communication. And I know that there have been some really good programs in the community and perhaps through various societies. So how important do you think it would be for somebody to attend a group with others in a similar situation?
I think it's a really good way of getting some really good strategies in place and practicing them in a really supportive environment. So there are a few different things. In Christchurch, Canterbury, New Zealand, we have a program called VAMP, which sounds very exciting, but it stands for Voice and Movement in Parkinson's. And that's a community group that was started up, the brainchild of 2 of my ex-colleagues, Alison Lunn and Joe Tipping, where we as a community team started working with physiotherapists to offer people like a circuit training that was communication and movement and had a byproduct of also helping swallowing, and included education for spouses or significant others. I think something like that again in Christchurch, to give you an example, there's also a Speak Out program run through the University of Canterbury, and that's an international program, I think, started by the Voice Project in Parkinson's. So they're just 2 examples of groups. I think And then I previously used to run a maintenance group that people could join after they'd done a treatment group. So after they'd actually got the strategies, then once a month we'd come together and just practice. And sometimes that really grew up out of me knowing, as someone who has a bend in my back, that when it's sore, I'll do my physio exercises religiously, and then it stops hurting, and life gets in the way and the exercises drop off. And I thought, what makes me keep my exercise up? And it was like once a month being accountable to seeing someone. So that was where that came out of, being accountable to each other and having a chance to just remember and get back into the practices. Because everything in Parkinson's, we know exercise helps, but that just means repeating the same thing over and over. So that practice can become repetitive, so it's keeping the energy up. But I think I've always felt that I've got far more out of facilitating any group than I could ever wish for, from the generosity and the wisdom of the people with Parkinson's and their partners and support people that come along and share their own solutions and group problem solve and support each other. And I think that's the benefit. I also do appreciate that groups aren't for everyone, and some people find that quite confronting, particularly early sometimes in their journey of Parkinson's. And if that's the case, there are some individual therapy options that sometimes can be a start, tailored for the person, and then leading into group. Something like LSVT, which is the Lee Silverman voice therapy, which is a program where you need a certified clinician, and that's a very intensive one-on-one program as well.
Now I've gone and lost my thread completely. Bear with me, this is why we have editing software, so that when the host loses the plot, we can edit things out. I'm wondering about singing. Is singing good for your voice?
Singing's excellent. So singing's excellent for your voice, for getting good breath support going behind your voice, but also the expressiveness of your speech, the clarity of your speech, and the expressiveness of your face, and also for that social connectedness. So either singing and something like, we're very lucky in Canterbury, we have the Canterbury's Therapeutic Choir, which is a choir for people with a variety of different neurological diseases or challenges. And that's run by a speech language therapist and a music therapist.
So how does one access that?
But also even just, so people can just Google that. It's called Canterbury's Choir, and make contact. There's a part charge for that, but it is also a charity that fundraises. So there can be things like a therapeutic choir or music therapy. And I'll give a shout out to our wonderful colleagues at Southern Music Therapy here in Christchurch that provide specialist music therapy. But even being involved, if you're someone who's loved singing, you're singing at church, singing in a community choir, if you're someone that hasn't loved singing, hasn't wanted to publicly sing, I wouldn't inflict myself on anyone, but I'd love singing in the shower or in the car with the radio cranked up. Getting some musicality going can really help with that naturalness and expressiveness, as well as getting better breath support. Yeah, we love singing.
And like you say, it's a social thing. I think one of the things with anything, with people with the early stages of dementia or Parkinson's, the less that they get the opportunity to actually need to vocalise because they're with people. And if they isolate themselves at home and aren't able to do that, then obviously their voice is likely to decline quicker because they're just not using it.
Absolutely. A big thing that you'll hear any speech language therapist or speech language pathologist say is use it and improve it. I always say to people, because there is that tendency to, I was a bit quiet, so I tried to order something at a cafe, they didn't hear me. I got a latte when I wanted an espresso, or my partner had to jump in and say it for me. So then the confidence goes, so then next time you just let them do it for you. And then you're doing less communicating, and so your confidence is going down and you're getting into a nasty, vicious spiral. So what we always say is you want to get out of that, don't use it and lose it, but get back into use it and improve it. And that might be as simple as sending one goal a week. Okay, for this week, when I go out on my walk, I'm going to say hello to one person I pass, and I'm going to try and use my loud, feeling loud voice. So what happens in Parkinson's is that effort that we've always put into our voice hasn't changed. We're putting the same effort in, but it's not getting the same volume as it used to. So it's almost like the miles to the gallon have gone down for the input. So you need to put more input, more effort, like you're thinking like you're being really loud or feeling that you're speaking with lots of intention just to get your normal volume. But just setting those weekly goals, or I'm going to go and speak to the cashier at the supermarket and ask them how their day is once this week, or I'll answer the phone at least once a day. But setting those goals that keep you still using it and improving it.
As I retired early last year, and I had some plans for things that I wanted to do with that retirement. One of them is playing bowls, which I haven't been able to do because of injury in my recent surgery, but that's going to happen by September, so that's all good. And that's a really good environment for me to be able to talk to people. And when you're sort of in a crowd of people, you do have to speak up as well. One of the things that I have done ever since I was diagnosed is I'm very open about my diagnosis and what I need and what happens and why. For example, one of the things I joined was Housey, and I thought that's a good thing because it's quite fast moving and you have to concentrate. But I've found that it's actually too much because it's too fast. And there are also some of the bowling ladies that go there, and I was talking to some of them yesterday, and one of them said to me, "You haven't been back to Housey?" And I said, "Yeah, I've found with my Parkinson's that my processing speed is slower. I'm a bit behind the eight ball trying to keep an eye on the numbers." So I said that it was actually becoming stressful for me. So that's one thing that I might drop because it's less beneficial and more stressful, so I don't need it. But, you know, when you have that slow processing, when you're trying to have a conversation and you've got somebody that's quite articulate like yourself and you're trying to hold on to the thread of a response, and then other people start chipping in the group, and then somebody very kindly might say, "Oh, Sue, did you have something to say?" And by then, yeah, it might have just gone somewhere in the ether and it never happens. But by telling people and being honest and open and saying, "This is how my Parkinson's affects me," it takes me a while to process. Just be aware of that if I don't respond immediately. And I think that's a really good thing to do, because people predominantly, they think of Parkinson's as a movement disorder, that you've got the shakes and you have trouble and things like that. But when you present reasonably well and reasonably competent, which I hope I do most of the time, people forget that you've got something going on. And I think sometimes a gentle reminder of, look, I wasn't being rude, not responding, or I'm sorry I didn't get back to you, but I had to process that information first. So people have that awareness that there are other aspects that people need to be aware of in this condition of ours.
Absolutely, and I think that's a big part of it, is educating communication partners, the people you communicate with, if you feel comfortable with that, and it can sometimes be really helpful to have some standard phrases that you use, like you were saying, Sue. "Oh, sorry, just because of my Parkinson's, I might take a while to get my thoughts together." Keeping and practicing saying those loudly and clearly so that they are automatic. You're not trying to have to think of how to explain that on the spot, can be really helpful. But another thing that can be a really good strategy is actually just keeping really good eye contact with the people you're communicating with. If they can see you looking like you're about to say something, most people will hold fire and let you take your time. But what can happen that can be really hard for people with Parkinson's is that use of eye contact drops. And it's amazing how when you're not holding on to eye contact with someone, they'll quickly move on or switch off.
Yeah.
And using those hand gestures as well.
Yeah.
Just indicate, "Hey, I want to say something."
We talked before about reading. I think we talked about reading stories to children, etc. One of the things that I've decided to do is something that I like to try and do things for myself that also benefit other people. It's the social worker, I can't help myself. And I write poetry. I think you're probably aware of that. And so
yes, I have. I've read some of your wonderful poems.
And my poems are designed to be read out loud. Since I've joined the bowling club, I've written about 8 poems about bowls, and we're having a closing ceremony on Saturday, and I'm going to read one of my poems as a farewell to the season at that event. And so I've read about half a dozen of them at various events, and that goes down really well. And that's just the things, but there's also a local rest home where my uncle's got an independent unit, and I'm going to be going there for the first time at the end of May to read some of my poetry out to some of the people at the rest home in their community lounge thing. So something that is different from somebody just coming and singing or whatever people normally have at those sort of gatherings. And I just thought, because my poems predominantly are fun and silly, that it was something I could do, and it gives me that interaction. It gets me to use my voice and to paint and all that sort of thing. So it has a number of facets that I think are useful for me, and hopefully people will enjoy hearing my poems.
Absolutely. Something else people can do at home, and it doesn't even have to be to an audience, but regularly trying to read aloud something that you find interesting. So that might be an article on stuff, it might be the newspaper, it might be a magazine, it might be, some people like reading their Bible aloud, it might be a novel that someone's reading, it might be a poem, a joke, and actually recording themselves on cell phone or something that's handy and listening back and just checking in. Am I taking a breath before I start to speak? How's my volume sounding? All of those things, and that's a really good strategy as well.
I think, like you say, if you're reading something that you're interested in, then you're going to read it because it's pleasurable. So you have to find, like with any exercise, I've got an exercise bike in the background there.
I can see
It's
that.
a bit of a storage unit at the moment. But yeah, it's finding an exercise, I think, whether it's vocal exercises or communication, or more physical exercises, like I talked to you earlier about my going aqua jogging. I think if you can find something that you enjoy that also has a social element, then I think you're on a win-win.
Absolutely, and there's actually some really good research about that. It shows us that the more salient or meaningful something is to us, and the more emotionally loaded it is, the more it fires up the limbic system in our brain, which is associated with memory. So that makes it easier to replicate whatever it was you're exercising, because so we can all think of things in our life that have happened that have been either really happy or really distressing or really anxiety provoking, and those memories are helped by the heightened emotion. So yeah, really when you're practicing using your voice, like with you, so your poetry is really meaningful and personal and fun, and so that's highly emotionally loaded. I had one chap that I worked really closely with, and I said to him, let's have a phrase where you can really practice your loud voice. And I said, what's the most emotional thing you say? And he said, go the mighty All Blacks. So I thought, that's a Kiwi bloke. But for him, that was, and we knew every rugby game, if nothing else, we were getting some really good voice. So actually, yeah, really finding something that's meaningful, because if you're just reciting a list of phrases that someone gives you because they think they'll be good speech practice, it probably won't really excite you. And then it'll be harder to retain, remember, and get involved. Yeah, absolutely. And emotional content can be positive, but it might be reading something from stuff, and there's lots of fodder for this at the moment, about something really horrible in the world or distressing or irritating or silly. But actually being able to read that to someone and then give an opinion is actually a really good way of practicing that good breath support, thinking loud voice, and with some emotional impact, that hopefully will help you retain those strategies.
And I'm finding, I don't know whether it's my age or whether it's my Parkinson's, but I'm a much more emotional being. And I wrote a blog post yesterday or the day before, and my husband came home and he said to me, are you all right? And I'd been crying. I'd written something that actually I made myself cry reading it back. So I was just like, yeah, words have a power to touch us, even if we don't think they will.
Oh. Absolutely, hugely. And I think that emotions being closer to the surface can be something some people with Parkinson's talk about. And part of that might be the chemicals in the brain, but part of it might be too that going through challenge and medication side effects and just the empathy that actually living day to day with something tough gives you for others and the power in words. But yeah, Speechies, a great believer in the power of words. It's what makes us human and connects us to others. And any way we can find to help people get that connection with others, and hopefully that's using their voice and whatever form that can be. I guess something we haven't touched on is if voice becomes really hard for someone with Parkinson's, there is sometimes equipment that we can put in place too, like even something as simple as amplifying their voice, or it might be an alternative way of communicating using text or typing or other things as well.
Yeah, I mean, there's lots of things to think about in our conversation today. And I was talking to you before we started recording about how I'd been doing my blog now for 4.5 years, and in more recent times I started the podcast. And I wanted to be able to interview people like yourself, people that would be useful for others with Parkinson's to hear from. But I also would love if I could find somebody with Parkinson's that would like to be interviewed. Maybe not for as long as we're doing this one. This is going to be a reasonably long one for me. But so that we can give people with Parkinson's a voice, the opportunity to say, this is me and this is how it affects me. This is who I am. I'm not just a person with Parkinson's.
Absolutely. And the power of what other people walking a journey, not the same journey, but with a challenge in common, I think can be more powerful sometimes than all the health professionals in the world.
Yeah, and I know a workshop quite some time ago, and they had somebody who had an area of expertise that was talking to us about Parkinson's, but they did not invite any kind of conversations within the group, didn't even share names, anything like that, whether we were a carer, whether we were a person with Parkinson's. And I have this thing that I say, when it comes to experts in Parkinson's, the experts in the room are us. The people that are actually not the people that have read, that have studied, that have passed exams, that are very intelligent people, I have no doubt, or else they wouldn't have got where they are today. But the real experts are those of us doing the hard yards.
Absolutely, and the people who do those hard yards beside you, the partner with the hearing loss.
Yeah, mine's got terrible.
Yeah, it's you guys are the experts on your whānau and what you need, and we might be able to give you some ideas from what we know, but you're the experts on what works for your life. And I always feel that every person I've worked with, I've gained so much more knowledge and wisdom from them than I could ever hope to try and give the odd little bit of advice here and there.
Yeah, and I think most of us, in the interactions that I've had with people in my blog and various Facebook groups, most of us do our best to be positive and live for the moment, live in the moment and make memories. But every now and again I think we have a right, everybody has a right to say, this is crap. This is not a happy situation. But to have those moments, to acknowledge those moments, but celebrate the good ones.
Absolutely, and I think it behoves the people that you work with, that you have the grace to let into your life, and by that I'm health professionals, the grace to come alongside and just give some ideas to actually remember, actually the experts, so you guys.
I think I might have to edit myself out a bit. Yeah, so take-home messages from our little conversation today. I would say from a person's perspective who is living with this condition, that gather together everybody that can help you, whether that's formal or informal supports. When it comes to speech language therapy, you do an invaluable job. The being able to communicate. Sorry. You do a valuable job. Sorry, I'm going to have to edit that out.
Or not so, because it's real.
Yeah. Because one thing I've always said that I would be, I think setting you off, is open and honest. It's not always easy, and you have the odd day when it just feels harder than some. But I think sometimes you just need to acknowledge that you're going through some stuff, and in acknowledging it and letting it be, you can move forward.
And I think, for what it's worth, I think that's beautiful role modelling to people, to be vulnerable and to say, this is me, good, bad, beautiful, ugly. But we're all on this planet struggling along.
We'll get there.
Yeah. And you're amazingly getting there, doing things like this and just giving people an opportunity to hear and see someone with Parkinson's taking to it. And if you want to talk about amazing communication skills like the blog and the podcasts and getting the message out there, is an absolute credit to you as a woman, as a person with Parkinson's, and as a social worker, because I don't think you let that go.
I think it'll always be a part of
It's just now done for free.
Yeah, and I think we all need to acknowledge that we need to feel these feelings, but I refuse to think too far ahead. Apart from we're having a nice break in Queenstown soon, so I'm happy to think that far ahead. But, you know, one thing that this whole situation with Parkinson's has taught me, that it's invaluable to have that time with friends, relatives, family, my children, that spending that time with people you love and who love you is the most important thing in the world.
And that's the best communication anyone can ever have.
Yeah. Before I dissolve into a puddle, I think we need to wrap this up. It's been wonderful talking to you, Kirstie. I hope you've been comfortable in this process.
Oh yes, thank you so much for giving me a chance to spout about something I feel really passionate about and lucky. Very lucky and privileged to be able to work with people.
And I think anybody that has the wonderful opportunity to work with you is very, very fortunate.
Oh, thank you. That's very kind.
We must do coffee.
Absolutely. Real life swallowing therapy.
And communication skills, all that.
Yep.
Okay, I think we'll wrap this up. So thank you, Kirstie, and I'll just wrap up now. This has been Sue for Parkies and Me, My Journey with Parkinson's. Kia kaha, be brave, be strong, be you.